Students and parents could be facing more stress and anxiety now than when the pandemic started. 7 News' Christine Scarpelli is live in Greenville with physicians offering ways to handle the pressure. Good morning, Christine.
Oh, yeah. Hey, good morning. Absolutely. Yeah, I'm telling you, physicians have a great perspective. They're able to see those that are struggling with exactly what you said: stress, anxiety, decisions, going back to school. Parents, we understand, we feel you, and so does Dr. Asa Briggs. Okay, family psychiatric nurse practitioner, which means you are seeing so many people in and out with a lot of the things we've been talking about, and really you're kind of here in many ways to offer a bit of a I understand.
Sure, exactly. So in terms of the COVID-19 pandemic, before we even start about talking about school, we really needed to talk about how the pandemic has really impacted individuals.
Okay.
I think, a lot of times we think about the pandemic as just being a disease, but you got to think about the stay-at-home orders. You have to think about social distancing. So oftentimes social distancing equates to social isolation.
Yes.
And for individuals that I'm seeing in my practice, social isolation is oftentimes indicative of depression. So what I'm seeing in my practice is a lot of people are having more depressive symptoms because they're not getting out. So before we start talking about going back to school, we need to really think about what are the parents going through and thinking about the partnership between the parents and the school system.
And childcare, things like meals.
Exactly.
I mean, these
exactly.
things. Yeah.
So lack of in-person instruction really disproportionately impacts low-income communities and minority communities, right? And so when you think about that difficult decision that parents are having to make to send their kids back to school, in the era of COVID-19, with the lack of resources, it's often a difficult decision. So I don't think that it's a right or wrong answer for these parents, but really it has to be a tailored approach with the school system and the parents working collaboratively together. Because we want to open schools, but we want to open these schools safely.
Yes, absolutely. Listen, I think at very least you are offering somebody who understands, a helping hand, somebody that's going through it with you, and resources. Let's check the screen right now. Those are at least 5 resources up there, places you can turn if you're having these feelings, these thoughts, a little bit of anxiety, depression, or even seeing some symptoms in other people, maybe a lack of self-care or a change in eating habits or sleeping habits. Guys, plenty more information right there. We're going to go through this morning, all morning, to be able to give you just a little bit better idea what to look out for. Back to you.
Thanks a lot, Christine. Such amazing information there that we all can use. We really appreciate it. Now we're going to head to Christy with a look at our forecast.